I'm Dr. John Hughes. I'm a consultant in pain medicine in Middlesbrough at the James Cook University Hospital, and I'm going to be talking about injections for non-specific low back pain. Low back pain is common. It's something that almost all of us will experience at least once during our life. It is usually self-limiting and will settle down over a few weeks, maybe months. And there's actually quite a lot you can do yourself to manage it. If that isn't sufficient, then you can go to your GP and they'll be able to help manage the pain as well and advance you through as to whether there's further intervention that's necessary. If your pain continues, you can go to your GP. They may well refer you into a national or a regional back pain pathway, which is designed for managing these sorts of problems. There you'll be assessed, and there are treatments that they will offer, which will include self-help, physiotherapy, psychological support, group exercise programs, and these often work very, very well. If it's either the GP or the healthcare professional involved with that program want to refer you in and feel you would be potentially appropriate for medial branch blocks and radial frequency lesioning, they'd then send you to a specialist pain service for assessment, which would again be fairly broad and will include potentially the intervention if you're a suitable candidate, but also other therapies at the same time so that you get the best outcome, which is improving your mobility and your function and quality of life. In the past, there's often been an injection called facet joint injection that a lot of people have had. These are no longer commissioned because the evidence isn't really there that they're of any significant benefit in the long term. And the benefits people have had in the past have often been no benefit or very short-term benefit, and therefore they're no longer commissioned. I'm a specialist in pain management, and these guidelines are, I think, beneficial because they improve patients' outcome and their quality of life with appropriate care to the level of problem that they have. The benefit then for me is that I can see patients who have got more complex problems in my clinics rather than those that don't actually need to come and visit us. I'm a supporter of the evidence-based interventions program for non-specific low back pain, and I think that the injections can be beneficial if they're targeted to appropriate patients, and this needs to be done with a degree of care. In the past, there have been far too many people getting injections that haven't really benefited, and by following this program we're going to be able to free up space to see more complex patients, which is more appropriate for secondary care.